Hello, everyone. Welcome, welcome, welcome. Hello. Hi, everyone. I hope you guys are hearing me. I hope you guys are seeing me. My reception is very, very low. But I hope you guys are hearing me and seeing me. If you are hearing me, please type in the chat you're hearing me. Greetings, Cherise. How are you? Welcome. I have a very low reception. I hope you can hear me. And if you can hear me, okay, thank you, Sharice. I appreciate that. Thank you so much. Hi, welcome, welcome, welcome. Come on in. Welcome to Q&A with Dr. Mercy. I am Dr. Mercy. Hello, Vincine Brown. How are you? I'm Dr. Mercy, and we're doing another session of Q&A with Dr. Mercy. So if you could, hi, Vonda, how are you? Hi, Patricia, how are you? If you could type in the chat where you're actually viewing my broadcast from, that would be great. Hey, Gary, how are you? Gary Woodcock, how are you? So let's get started. During today's week, we're going to discuss monkeypox. Now, we've all heard about monkeypox, and so some of us may still not know what's going on. Thank you, Dr. Marini. I'm glad you can hear. Oh, Sharice, you're from Anderson, South Carolina. Awesome. I would be putting your comments on the actual screen itself, but I'm already having trouble trying to put my presentation there. So I'll just only respond when I see your comments. Hi, Deborah Smith from Georgia. Hi. So anyways, like I said, we've all heard about monkeypox and, supposedly it's contagious and it's been growing in cases, but what really is going on with it? How should we know when we see it? What should we see? Let me repeat that again. What should we know when we see it, and if we even get exposed, what is the treatment options? So I create this presentation just for us to be aware of monkeypox, what it is, and what we should do about it. If you have any questions on monkeypox, please feel free to write it in the chat box. As I'm going through the presentation, I'll try to answer them. If I'm not able to, I'll answer it at the end of the presentation. Okay, so let us just hi, good day. You're from Atlanta, Vincine. Oh, that's great. That's awesome. So let's just go ahead and start with the presentation. And again, my reception is very poor, so I apologize. Location, my usual location. I'm actually traveling. So, what exactly is monkeypox? Monkeypox is, as you already know, is a virus. But what you may not know is a virus very similar to the smallpox. And it makes sense when you look at the actual bumps, as noted on the right side of the presentation. You can see the little bumps, and they kind of resemble the smallpox. So it makes a lot of sense that it is very similar to the smallpox. In fact, it is in the same family as the smallpox. If we're going to consider them family, we would say they'd be almost like cousins. They're within the DNA family of viruses. Now, they're different from COVID because COVID is an RNA virus. So it's on a separate category than the monkeypox. But the monkeypox and the smallpox are related. That's why some experts are suggesting that if you want to prevent from getting monkeypox, you should be really up to date with your smallpox vaccinations. They state that some of that vaccinations could actually protect you from actually getting monkeypox. So that's really a good fun fact to know. So just as I alluded to earlier, monkeypox causes some red bumps that can be seen anywhere throughout your body, and this red bumps is oftentimes filled with pus. And that's why if you look closely on that picture on the right with the hands, you can see in the bumps the center area looks white, and that's usually that white area is the area that's filled with pus. So it can be found in all parts of your body. It can be found in your face, it can be found in your hands, it can even be found in your genitals or your anal part. That is how it spreads anywhere in your body. So, but again, for the slowness, how can you get monkeypox? Monkeypox, as you guys are aware, is transmitted person to person. But you can also spread it to your pets. And there has been some cases where obviously pets have spread it or animals have spread it to humans. That's the whole reason why monkeypox came into being. It was actually found initially in the 1950s in in crab eating monkeys. That's how they knew about monkeypox. And they studied it in the lab, these monkeys, and this is how they were able to extract the virus. So it actually started in animals. They first noticed it in monkeys. And since then, it's been transmitted to person. And primarily, you can get monkeypox through contact with the skin bumps or lesions. But not only that, you can get it from any intimate contact. So if you're kissing, if you're having oral sex, vaginal sex, anal sex, you can get monkeypox if the person is even respiratory secretions. Okay, even like just even inhaling monkeypox from somebody who just exhaled them, you can monkeypox. And even kissing, so saliva, or sharing contaminated utensils. So you're someone, they happen to have monkeypox, they're using a spoon, they're giving it to you, you're using that same spoon, you can get exposed to the monkeypox virus through that. Okay, so this is not the first time that there's been an outbreak. Lots of times you see this outbreak of monkeypox in Africa, but this is not the first time there was an actual outbreak in the United States. Actually, in the early 2000s, I believe it was 2003 or 2005, one of the two, that was when there was an outbreak of monkeypox. I guess it wasn't just large enough for us to be aware of it, but this is actually, if not the second time, if not a repeat time of monkeypox. So this monkeypox outbreak started in May of 2022, and it was actually in Europe. It started in Europe. An immigrant from Africa came into UK, and then it spread from there. Usually when you get exposed to monkeypox, it takes anywhere from 5 to 21 days before you actually show signs and symptoms. So day one of exposure, you won't feel something until day 5, and it may go all the way out to day 21 before you actually experience some symptoms. So what are other signs and symptoms? It's not only the bumps that you see, you also have other symptoms that you're experiencing as well. And for some people, they have fever, they have swollen lymph nodes. So remember, lymph nodes are those collection of areas in your body that helps to house inflammatory cells that fight the virus. So you sometimes have lymph nodes in your neck, you have them in your armpit, you have them in your groin. So when you have an active infection, those areas where your inflammatory markers are inflammatory markers / cells are housed to fight infection starts to enlarge, and you'll see like bumps along your neck, bumps along your armpit, bumps along your groin. That is a sign that something is going on. They also experience tiredness, muscle aches, kind of like the flu, and they have cold-like symptoms, so running nose, congestion, sore throat, and obviously they have the rash. How long does it last? Well, it typically lasts about 2 to 4 weeks, and currently there is no cure for it. So once you get it, you pretty much have it for the next 2 to 4 weeks. We don't have any treatment available for it at this time. A person is contagious while they have the skin bumps and even the scabs on their body. They start not being contagious once new skin growth starts to occur. So, um, how does one protect themselves? Well, key, avoid close contact with anybody who is suspected of having monkeypox. So you saw the pictures of those skin lesions on that a hand of that individual. If you are coming across people who have skin lesions that are very similar to that, yeah, you may want to avoid close contacts with them until they tell you no, this is not monkeypox, or until it's confirmed that it's not monkeypox. That means no close contact. That means also avoid touching items that people who have monkeypox have have access to. Avoid touching those items. Always wash your hands. Nowadays, it's not only for monkeypox, but even for COVID. You want to be washing your hands if you're touching items of common places that other people are touching before you start eating or putting objects in your mouth or your eyes or anything where like your mouth, eyes, or any intimate areas. You want to wash your hands just in general. But in this particular case, in the monkeypox, it's important to wash your hands often. And another way to protect yourself is by getting the vaccine. Like I said, smallpox is closely resembles monkeypox. So some have said that having an up-to-date smallpox vaccine can help, but there is a vaccine out there that is specifically for monkeypox. Currently, it's reserved for those of high risk and those who may progress to have severe symptoms if they have it. So, who are those who are at high risk for having monkeypox? Well, at this point, the population that's of high risk is those of men who have sex with men. So men who have sex with men, gay men or bisexual men who have sex with men tend to have a high risk of having monkeypox. Second group that also is a high risk is those who have multiple unprotected sex. That is also of high risk. So sexual activity, whether it's unprotected or whether it's men having sex with men, can increase your risk of having monkeypox. So, and this is a typo here. I'm sorry about it. It's supposed to say, what if I think I have it? Okay. So, what do you do if you think you have it? Well, obviously, the first thing you should do is go to your doctor for confirmation. Sometimes, just by looking at it, they can say, oh, yes, you do, in fact, have monkeypox. And they will likely tell you to isolate yourself. That means for the next 2 to 4 weeks until your skin lesions heal over, isolate yourself if you can from family, friends, and definitely from work. That would be key. The whole key is to prevent spreading of the monkeypox. So go and confirm with your doctor. And the way they can confirm whether or not you have monkeypox is if they look at the lesion, they can do scrapings from the lesion, send it to the lab, and confirm. And the reason why some may want to confirm it, because sometimes, like I said, monkeypox can mimic smallpox, but it can mimic other kinds of skin lesions. So to confirm that you have it, they may want to scrape some skin off and send it to the lab. So let's say you are confirmed and you do have it. Now what? Well, what you want to do is you want to cover any exposed bumps, lesions, because these bumps and exposed bumps and lesions, they tend to contain the virus, which can cause spreading, if not to others, but to yourself. So let's say you have the lesion on your arm and you've been touching it and then you rub your face with it. Next day, you may have some lesions in your face. So it's always it's best to cover up any exposed bumps or skin lesions. You can do it with a Band-Aid or gauze of some sort to prevent spreading not to others, but to yourself. Also, if you're going to be messing around in the area, you want to wash your hands after touching any exposed lesions. You want to wash your hands again to prevent spread for yourself and for others. Usually, these lesions can be itchy, so you may want to put some anti-itch lesions, anti-itch lotion on. If you have a fever, obviously ibuprofen will help. Just for now, it is really supportive care. So it's really helping with the symptoms, but there's nothing curative at this point. And lastly, remember to always wear a mask if you're going to be in contact with others and you have the monkeypox. Like I said, monkeypox can be transmitted respiratory. So some people can get it just by being in close contact with you and breathing in your air. So you want to wear a mask if you do have it. The whole thing is to help prevent any spread. So there is the conclusion of the overview of monkeypox. I hope you guys were enlightened by what I've had to share. I'm going to go back to see on the comment section. If you have any questions, feel free to jot them down in the comment section. Let me see. Okay. If you have any questions, just feel free to jot down. And if you have any questions later on, also feel free to jot down as well. I will be making sure to respond to that as well. Okay. All right. Well, I'm glad I was able to share about monkeypox. If you have any questions regarding monkeypox, if you have any questions in regards to any other conditions that are prevalent from a medical standpoint, I'm here to be a beacon of knowledge, and let's discuss and go from there. Guys have a wonderful, wonderful weekend, and until next time, bye.